Here beneath it is the opening for the nasolacrimal duct. Beneath the middle concha, which was here, is a deep groove called the semilunar hiatus. To see where this leads, we'll retract its lower border with this thread. The semilunar hiatus leads into a narrow, irregular side chamber called the infundibulum. The infundibulum receives the openings of the frontal sinus and the maxillary sinus. Sometimes the more anterior ethmoid air cells open into the infundibulum too. Sometimes, as in this case, they open separately, below the middle concha. Here's where the superior concha was. The more posterior ethmoid air cells open below the superior concha. The sphenoid sinus, which is this cavity, opens forwards into the highest part of the nasal cavity, the sphenoethmoidal recess. Here's the frontal sinus cavity in a different specimen. The opening to the frontonasal duct is behind here. To see the other sinus cavities, we'll take a look from the outside at a dissection in which all the facial soft tissues have been removed. Here's the maxillary sinus cavity, opened from in front. The opening from the sinus into the infundibulum is all the way up here on the medial wall. Here are the ethmoid air cells, with the lamina papyracea removed. This opening in the medial wall of the orbit also exposes the infundibulum. Now we'll move back and look at the nasopharynx. To do that, we'll put the nasal septum back in place. Here's the right half of the nasopharynx. The openings from the two nasal cavities into the nasopharynx, here's the right one, are called the choanae, or posterior nares. The roof of the nasopharynx lies underneath the basilar part of the occipital bone. The back of the nasopharynx lies in front of the atlas vertebra. Here's the anterior arch of the atlas. In the mucosa of the lateral wall of the nasopharynx, there's a pronounced inward fold called the torus tubarius. It's produced by the inward projection of the cartilage of the auditory tube. The mucosal opening of the tube is here. Behind the torus tubarius is a deep recess, the pharyngeal recess. The floor of the nasopharynx is formed by the soft palate, which forms a highly mobile partition between the nasopharynx and the back of the oral cavity. The nasopharynx opens downward into the oropharynx. The soft palate can move upwards, backwards, and downwards. Its movements, which are important in swallowing and in speech, are produced by several small muscles. These converge on the soft palate from above and from below. Most of them insert on a sheet of aponeurosis or tendon-like material that occupies this part of the palate. In this section, we'll see only the palatal muscles that come from above. We'll see the ones that come from below in the next section. The two that we'll see now are the levator palati and the tensor palati. To see these muscles, we'll remove the mucosa of the nasopharynx. Here's the end of the cartilage of the auditory tube. Here below it is the levator palati muscle. Its full name is the levator veli palatini. Levator palati arises here on the petrous temporal bone. It passes along the underside of the auditory tube, downward and medially, and joins in the midline with its fellow from the other side, forming a sling. Levator palati moves the soft palate upwards and backwards. To see the tensor palati muscle, we'll remove the levator. Here's tensor palati. Tensor palati arises from this area, just above the root of the medial pterygoid plate. Here's the edge of the medial pterygoid plate. The fibers of tensor palati pass downward and forward towards the pterygoid hamulus, which is here. The tendon of tensor palati makes a complete 90-degree turn round the pterygoid hamulus. Here's the tendon emerging. It passes medially to insert on the palatal aponeurosis. The action of tensor palati is to tighten the palate when the tongue presses up against it in the act of swallowing. It also may help to open the auditory tube. We'll end this section with a look at the auditory tube. Here's the end of the cartilage of the auditory tube. The cartilage doesn't form a complete tube. It's open on the underside. Here's the cut edge of the mucous membrane, which forms the real auditory tube. It passes backwards and laterally to reach the cavity of the middle ear. The function of the auditory tube is to keep the pressure inside the middle ear the same as the pressure outside it. Now, let's review what we've seen of the upper part of the air passage. Here are the nostrils, or anterior nares, the columella, the lateral cartilage, the alar cartilage, the septal cartilage, the nasal vestibule, and the olfactory area. Here are the conchae again, superior, middle, and inferior. Here's the nasopharynx, with the torus tubarius, the pharyngeal recess, and the soft palate. Here's the semilunar hiatus and the infundibulum. Here's the levator palati, the tensor palati, and the cartilage of the auditory tube. That brings us to the end of this section on the upper part of the air passage. In the next section, we'll look at the upper and lower jaws and the oral cavity. In this section, we'll look at all the structures, other than nerves and blood vessels, that are connected with the oral cavity and pharynx. We'll look at the upper and lower jaw and the muscles of mastication. Then we'll look at the hyoid bone and the tongue and their muscles. Then we'll see the muscles of the cheek and lips. Then the teeth and the salivary glands. And lastly, we'll look at the pharynx. It's going to be a long section. Don't aim to watch it all at once. In looking at the jaws, we'll start, as always, with the bones. The word jaw is used in two ways. When we speak of jaws, in the plural, we're referring to both the upper jaw, the maxilla, and the lower jaw, the mandible. When we say jaw in the singular, as in jaw movement or jaw bone, we're referring to the mandible. We'll take a good look at the mandible in a minute. Before doing that, let's take a fresh look at the parts of the facial skeleton that we'll be seeing in this section. Here's the zygomatic arch, enclosing the temporal fossa and the infratemporal fossa. Here's the joint surface of the temporomandibular joint, with the external auditory meatus and the styloid process just behind it. Here are the pterygoid plates, with the pterygoid fossa between them. This sharp projection, just medial to the temporomandibular joint, is the spine of the sphenoid bone. The part of the maxilla that bears the teeth is called the alveolar process. We'll look at the teeth later in this section. The alveolar process ends behind at the tuber. Now we'll bring the mandible into the picture. The mandible develops from two originally separate bones, one on each side, which fuse together here at the symphysis. The mandible is described as consisting of the body and the right and left ramus. The corner between the ramus and the body is the angle of the mandible. The rounded projection that articulates with the temporal bone is the condyle or condylar process. The narrowing below the condyle is the neck. The sharp, slender projection in front of the condyle is the coronoid process, a major muscle attachment, as we'll see. The dip between the coronoid process and the condyle is the mandibular notch. The angle of the mandible is roughened on the outside and on the inside by the insertions of a matching pair of muscles, the medial pterygoid on the inside and the masseter on the outside, which we'll see shortly. The body of the mandible is described as consisting of the base and the alveolar process. The side of the body slopes upward and inward, slightly on the outer aspect, markedly on the inner aspect. The posterior part of the alveolar process bulges medially above this hollow, the submandibular fossa. This projection in the midline is the mental protuberance. On the inside, this roughened area is the mental spine. Two pairs of muscles are attached here, the geniohyoid and genioglossus muscles. On the inner aspect of the mandible, this thickening below the coronoid process is the buttress. In the middle of the ramus, level with the tops of the teeth, is the mandibular foramen. Just in front of it is a small upward projection, the lingula. The mandibular foramen is the start of a tunnel for the inferior alveolar nerve and blood vessels. A major branch of the nerve emerges on the outside at the mental foramen. Now that we've seen the mandible, let's take a look at the joint that enables it to move, the temporomandibular joint. It's a synovial joint, with articular cartilage on the bone surfaces and a joint capsule that encloses synovial fluid. It's a double joint. There are two separate synovial cavities, one above the other. These are separated by an articular disc that's flexible and highly movable. This arrangement permits two kinds of movement, as we'll see. Here's what the two joint surfaces look like in the living body. They're shaped quite differently. The articular surface of the condyle is curved sharply from front to back. It's almost pointed on the top. The articular surface of the temporal bone has a double curve. This concave part is the mandibular fossa. This convex part is formed by the downward bulge of the articular tubercle. Here's the temporomandibular joint with its joint capsule intact. Most of the capsule is thin and loose to allow the various movements that we'll see. On the lateral aspect, the capsule is thickened by this lateral ligament. The articular disc is inside the joint, here. To see it, we'll remove part of the capsule above and below it. Here's the upper joint cavity. Here's the lower one. Here between them is the articular disc. It's made of dense fibrous tissue. It's attached to the joint capsule all the way round its edge. Here's the articular disc by itself. It's thin in front and thick behind. It's quite flexible. The two kinds of movement that can occur at the temporomandibular joint are a hinging movement and a forward and backward gliding movement. The hinging movement takes place between the condyle and the disc. The backward and forward movement takes place mainly between the disc and the temporal surface. The normal opening and closing of the jaw is a combination of the two movements. If you put your finger here, you can feel the condyle moving forwards as the jaw opens. forward movement of the body of the mandible is held in check by two ligaments that lie outside the temporomandibular joint. We'll add these to the picture after we've looked at the four principal muscles that move the jaw. We'll move on now to look at those four muscles. They're known collectively as the muscles of mastication. The muscles that close the jaw are much more powerful than the ones that open it. Closing is produced by three large muscles on each side: the medial pterygoid, the temporalis, and the masseter. Opening is produced by the lateral pterygoid muscle, which we'll see in a moment, and by some smaller muscles below the mandible that we'll add to the picture later in this section. Of the four muscles that we'll look at now, we'll start with the one that's hardest to see, the lateral pterygoid. To get a look at it, we need to remove the coronoid process and the zygomatic arch. This lets us see the infratemporal fossa and, behind it, the lateral pterygoid plate. Here's the lateral pterygoid muscle. It's quite small. The lateral pterygoid muscle arises partly from the underside of the greater wing of the sphenoid and partly from the lateral aspect of the lateral pterygoid plate. The fibers of the lateral pterygoid muscle run backward and a little laterally. We'll go round to a medial view to see where they go. The main insertion of the lateral pterygoid is into this hollow on the front of the condylar process. The lateral pterygoid also inserts onto the capsule of the temporomandibular joint and into the front edge of the articular disc. These windows in the capsule were made artificially, as in the shot that we saw previously. Now that we've seen the lateral pterygoid, we'll add the medial pterygoid muscle to the picture. The medial pterygoid muscle is larger than the lateral pterygoid and runs in a quite different direction. The medial pterygoid muscle arises from both the pterygoid plates, the medial aspect of the lateral one and the lateral aspect of the medial one, also from this corner of the maxilla, the tuber. The fibers of the medial pterygoid muscle run downwards, backwards, and laterally. They insert here along the inner aspect of the angle of the mandible. Before adding the next muscle, the temporalis, to the picture, we'll put the coronoid process back in place, since that's where the temporalis inserts. Here's temporalis, the largest of the muscles of mastication. It's shaped like a fan. The temporalis arises from the wide area on the side of the skull that lies within the temporal line. The fibers of temporalis converge from above and from behind on the coronoid process. They insert on the outer aspect and the inner aspect of the coronoid process, and also here on the anterior part of the ramus of the mandible. Now we'll put the zygomatic arch back into the picture. The temporalis muscle lies inside the zygomatic arch. Near its insertion, the temporalis is a thick muscle. It occupies the whole of the infratemporal fossa. The temporalis muscle is covered over by this dense layer of deep temporal fascia. The fascia is attached to bone along the zygomatic arch and all the way round the temporal line. Lastly, we'll add the masseter muscle to the picture. Here's the masseter. It's a thick, powerful muscle. The masseter arises from the anterior two-thirds of the lower border of the zygomatic arch on its outer aspect, and from the whole length of the arch on its inner aspect. The fibers of the masseter muscle that arise on the outside run downwards and backwards. those on the inside run straight downwards. The masseter inserts into this wide area on the angle and ramus of the mandible. The masseter muscle on the outside and the medial pterygoid muscle on the inside converge on the angle of the mandible in very similar ways. Now, let's take a look at the actions of the muscles that we've just seen. The action of closing the jaw is performed by the upward pull of the temporalis, the masseter, and the medial pterygoid muscles. Opening of the jaw is brought about partly by the force of gravity, partly by the forward pull of the lateral pterygoid muscles, and partly by the backward and downward pull of muscles we'll see in a minute that act by way of the hyoid bone. We've not yet seen the two accessory ligaments that restrain forward movement of the mandible. These are the stylomandibular ligament and the sphenomandibular ligament. The stylomandibular ligament goes from the styloid process to the angle of the mandible. The sphenomandibular ligament goes from this small projection, the spine of the sphenoid, to the lingula. Now that we've looked at the mandible and the principal muscles that move it, we'll move on to look at a small but important bone that we haven't seen yet, the hyoid bone. The hyoid bone is a slender U-shaped bone. It's suspended just beneath the mandible. It isn't directly attached to any other bone. You can feel your own hyoid bone here, and you can move it from side to side. Together with its attached muscles, the hyoid bone has two important functions. It holds up the tongue, which sits above it, and it holds up the larynx, which hangs below it. It also transmits the force of muscles that help to open the jaw. Let's take a closer look at the hyoid bone. This broad central part is the body. Its forward-facing upper surface is convex, with facets for the attachment of numerous muscles that we'll see shortly. The backward-facing lower surface of the body is deeply concave. On each side, this long, slender part of the hyoid bone is the greater horn, or greater cornu. The greater horn is attached to the body by a small synovial joint, which gives it a little mobility. This small projection is the lesser horn, or lesser cornu. When the structures above and below it are at rest, the hyoid bone lies slightly below the lower border of the mandible. In the frontal plane, the body of the hyoid is about in line with the last molar tooth. From its resting position, the hyoid bone can be moved upwards and downwards, and forwards and backwards, by the muscles that are attached to it. Now, we'll look at the muscles that hold the hyoid bone in place and cause it to move. There are 7 pairs of them. 2 that pull the hyoid bone upwards and forwards, 1 that pulls it upwards and backwards, 1 that pulls it upwards by means of a pulley, and 3 that pull it downwards. We'll start with the 2 that pull upwards and forwards, the mylohyoid and geniohyoid muscles. Here are the 2 mylohyoid muscles. Between them they form a continuous sling of muscle that forms the mobile floor of the oral cavity. The mylohyoid muscle arises from the mylohyoid line on the mandible. Most of its fibers pass downwards and medially, joining in the midline with the fibers from the opposite side, all the way from the symphysis of the mandible to the body of the hyoid bone. The more posterior fibers of the mylohyoid insert here on the body of the hyoid bone. The mylohyoid muscle has a free posterior border, which runs straight downwards when seen from the side, also a little inward when seen from behind. Now we'll add the 2 geniohyoid muscles to the picture. Here they are. They lie above the mylohyoid. On each side, the geniohyoid arises from the lower part of the mental spine. It inserts here, on the body of the hyoid bone. Now we'll bring the base of the skull into the picture and add the muscle that pulls upwards and backwards, the stylohyoid. Here's the stylohyoid. It's a long, slender muscle. Just above its insertion, there's an opening in the stylohyoid. The digastric muscle passes through this opening, as we'll see. The stylohyoid arises from the lateral aspect of the styloid process. It's inserted on the base of the greater horn of the hyoid bone. Next we'll add the digastric muscle to the picture. Here it is. The digastric muscle is unusual in that it has two bellies, an anterior and a posterior, that are connected in the middle by a tendon. The posterior belly of the digastric arises here from the digastric notch on the underside of the temporal bone and from the medial aspect of the mastoid process. The origins of the sternocleidomastoid and splenius muscles, which have been removed in this dissection, lie lateral to it. The posterior belly narrows to a tendon which passes between the two slips of the stylohyoid. The digastric tendon then passes through a sling of fibrous connective tissue by which it's tethered to the hyoid bone, here. The tendon then broadens out into the anterior belly of the digastric, which runs almost straight forward beneath the mylohyoid. It's attached low down on the inner aspect of the body of the mandible, just lateral to the midline. Lastly, we'll take a brief look at the attachments of the three muscles that pull the hyoid bone downwards. They're the omohyoid, sternohyoid, and thyrohyoid muscles, known collectively as the infrahyoid muscles. Here's the body of the hyoid bone. Here's the upper end of the omohyoid muscle, which goes all the way down to the scapula. Medial to it is the sternohyoid muscle, which goes to the sternum. Behind these two is the short thyrohyoid muscle, which goes down to a structure we haven't seen yet, the thyroid cartilage. These muscles insert on the edge of the body of the hyoid bone, the thyrohyoid here, the omohyoid here, and the sternohyoid here. We'll see these three muscles more fully later in this tape. The infrahyoid muscles pull the hyoid bone downwards. Acting together with the digastric muscle, the infrahyoid muscles assist in opening the jaw. The actions of the other hyoid muscles that we've seen are evident from the direction of their fibers. Now that we've seen the hyoid bone and the muscles that hold it in place and move it, we'll move on to look at the tongue. The shape of the mobile anterior part of the tongue is familiar to us from everyday encounters. What's perhaps surprising is how much of the tongue we don't see from in front. The tongue goes a long way back and a long way down. To understand the overall shape of the tongue, let's look at a specimen that's been divided in the midline. All this is the tongue, right back to here. The tongue consists almost entirely of muscle, covered by specialized mucous membrane. The freely mobile anterior part of the tongue almost fills the oral cavity. The massive posterior part of the tongue, which is much less mobile, faces backwards into the oropharynx. This structure below and behind the back of the tongue is the epiglottis. We'll see it in the next section. To get a look at the intact tongue, we'll look at a specimen consisting of just the tongue, the mandible, and the hyoid bone. Here's the mylohyoid muscle. The body of the hyoid bone is here. Here's the greater horn. We'll look at the outside of the tongue first. The tongue is covered with mucous membrane on top, on the sides, and also here in front on the underside. The mucous membrane of the tongue is continuous with the mucous membrane that covers the floor of the mouth and the alveolar process. There's a deep valley between the alveolar process and the side of the tongue. This projecting fold in the midline is the frenum. On either side of it, the submandibular ducts open, as we'll see later. The mucous membrane over the root of the tongue is thin and mobile. Over the sides and the upper surface, the mucous membrane is thick, firmly attached to the underlying muscle, and covered by projections, called papillae. The largest of these, the valleculate papillae, are in a row back here. This shallow pit in the midline is the foramen cecum. The muscles that form the bulk of the tongue are intrinsic muscles, which run from one part of the tongue to another, and extrinsic muscles, which are attached to bone. There are 3 extrinsic muscles on each side. Of these, the 2 largest, which we'll see now, are hyoglossus and genioglossus. The other one, styloglossus, we'll see later. To get a view of the major extrinsic muscles, we'll divide the mandible along this line and remove the ramus and the alveolar process. We'll also remove all of the mucous membrane from this line downwards. Here are the hyoglossus and genioglossus muscles, which together form the root of the tongue. To see the full extent of genioglossus, we'll remove hyoglossus for a moment. All this is genioglossus. Genioglossus arises just above the geniohyoid from the upper part of the mental spine. Its fibers fan out, the highest ones arching forward almost to the tip of the tongue, the lowest ones running straight backward to the most posterior part of the tongue. Genioglossus compacts the tongue and pulls it forwards. Now we'll put hyoglossus back in the picture. Hyoglossus is a thin, flat sheet of muscle. Its fibers run upwards and forwards. Hyoglossus arises from the whole length of the greater horn of the hyoid bone. Here's the greater horn, and ends here, along the side of the tongue. Hyoglossus flattens the tongue and pulls it backwards and downwards. Here alongside hyoglossus is the 3rd extrinsic tongue muscle, styloglossus, coming in from behind. We'll see it later. Here's the mylohyoid muscle, seen from behind. The space between the mylohyoid and hyoglossus muscles is the pathway for the nerves to the tongue and the submandibular duct, as we'll see in the next tape. The intrinsic muscles of the tongue, which we won't look at in detail, run both longitudinally and transversely above and between the extrinsic muscles. They're responsible for many of the fine movements that are involved in handling food and in speech. We've looked at a lot of muscles in this section: the muscles of mastication, the muscles of the hyoid bone, and the extrinsic tongue muscles. Later in this section, when we look at the salivary glands and at the pharynx, we'll have a chance to see how all the muscles fit together that we've seen up to now. Before we move on, let's review the structures that we've seen so far in this section. Here's the ramus of the mandible. Here's the body, formed by the alveolar process, and the base. Here's the angle, the condyle, the neck, the coronoid process, and the mandibular notch. Here are the symphysis, the mental protuberance, the buttress, the mandibular foramen, the lingula, the mylohyoid line, the submandibular fossa, and the mental spine. Here's the temporomandibular joint, the articular disc, the stylomandibular ligament, and the sphenomandibular ligament. Here are the lateral pterygoid muscle, the medial pterygoid muscle, the temporalis, and the masseter. On the hyoid bone, here's the body, the greater horn, and the lesser horn. Here are the mylohyoid muscles, the geniohyoid, the stylohyoid, the digastric, the omohyoid, sternohyoid, and the thyrohyoid. Here's the genioglossus muscle, and here's the hyoglossus. Now we'll move on to take an overall look at the oral cavity and at some important closely related structures. We'll look first at the shape and extent of the oral cavity. Then we'll look at the muscles of the cheek and lips, then at the teeth, then at the salivary glands. To understand the shape of the oral cavity and its extent, we'll look at it in a living model. Here's the tongue, here's the palate, here's the inner aspect of the alveolar process of the maxilla and of the mandible. The alveolar processes of the maxilla and mandible, together with the upper and lower teeth, project into the oral cavity from above and below. They divide the oral cavity into an inner part and an outer part. The upper and lower gums, or gingivae, are formed by mucous membrane that covers the alveolar processes on the outside and on the inside. The outer part of the oral cavity, the vestibule, lies between the teeth and gums on the inside and the cheek and lips on the outside. The mucous membrane of the lips and cheek is continuous above and below with the mucous membrane of the gums. The inner part of the cavity is closed off above by the hard palate and further back by the soft palate, which ends back here at the uvula. It's closed off below largely by the tongue and also by the mucous membrane of the floor of the mouth. To see the features of the posterior part of the oral cavity, we'll look at a dissected specimen that's been divided in the midline. This specimen is missing a number of teeth. The mucous membrane that lines the cheek passes medially behind the last molar teeth and becomes continuous with the mucous membrane of the inner part of the oral cavity. The front of the ramus of the mandible is here. To look at the wall of the oral cavity further back, we'll move the soft palate backward. This fold in the mucous membrane, running from the soft palate to the side of the tongue, is the palatoglossal arch. It acts as a dam, preventing liquid from spilling backward past the side of the tongue. This less noticeable fold is the palatopharyngeal arch. This triangle between the two arches is occupied in early life by a prominent mass of lymphoid tissue, the tonsil. In later life, as in this specimen, the tonsil atrophies. Here's the palatoglossal arch in a young person. Here behind it is the tonsil. We'll look at the soft palate along with the pharynx at the end of this section. Now that we've looked at the overall shape of the oral cavity, we'll move on to look at the muscles of the cheek and lips. The muscles we'll look at are the buccinator, which forms the muscular lining of the cheek, and the complex of muscles that surround the mouth, collectively called the orbicularis oris. Before looking at these muscles, we need to get acquainted with a ligamentous structure that the posterior fibers of the buccinator are attached to, the pterygomandibular band, also called the pterygomandibular raphe. The pterygomandibular band, represented by this piece of material, passes from the pterygoid hamulus to the posterior end of the mylohyoid line. Two muscles arise from it, the buccinator in front and the superior constrictor of the pharynx behind. The pterygomandibular band can stretch to accommodate jaw movement. Now, to see the muscles of the cheek and lips, we'll look at a dissection in which the skin and subcutaneous fat have been removed from the lower part of the face.